Every month, inside the body of nearly every woman on this earth, an extraordinary biological symphony unfolds. Hormones rise and fall with perfect precision. An egg is carefully prepared and released. The uterus rebuilds an entire inner lining, rich with blood vessels, ready to nurture new life. Yet most women, and far too many of our daughters, have never been taught the complete truth about what is actually happening. They experience the discomfort, the emotional shifts, the bleeding, but they don't understand the remarkable purpose behind it. Today, I'm Dr. Fredrick, and in this in-depth presentation from Secret Anatomy, I'm going to walk you through the full, complete story of the female menstrual cycle, from the first day of your period through ovulation, all the way to the end of the cycle. You will finally understand exactly what your body is doing each phase, why you feel the way you feel, and precisely how to explain this to your daughters the moment they begin noticing changes. I have created many other important health videos right here on this channel, videos on hormone balance, breast health, menopause preparation, and more, all designed to give you the knowledge you truly need. Stay with me until the very end, because the final revelations about when to seek medical help and how to track your cycle with confidence could make a lasting difference in your life and in the lives of the young women you love. If this message already resonates with you, please take a moment right now to like this video and subscribe to Secret Anatomy. I strongly encourage you to do so because these educational videos are created specifically to empower you and your family with accurate medical understanding. Turn on notifications so you never miss future episodes that matter to your health. Hello, I'm Dr. Fredrick, a physician with over 25 years of experience in women's reproductive health. Welcome to Secret Anatomy, where we explore the hidden workings of the human body with clarity, compassion, and scientific accuracy. My goal today, and in every video on this channel, is simple: to educate, never to alarm. I want every woman watching, especially those over 40, to feel informed and confident about your own body so you can guide the next generation with wisdom and without shame. The menstrual cycle, the full journey. Let us begin at the very foundation. Your reproductive system is centered in the pelvis and governed by an elegant communication network between your brain and your ovaries. The hypothalamus and pituitary gland send chemical signals, hormones, that orchestrate everything that follows. Phase 1, the menstrual phase, days 1 to approximately 5. This is what we commonly call your period. When pregnancy has not occurred, levels of estrogen and progesterone drop sharply. The thick, nutrient-rich lining of the uterus, the endometrium, is no longer needed. Your body gently sheds it. What you see as menstrual blood is actually a mixture of blood, endometrial tissue, and mucus. The uterus contracts to expel this material, which is why some cramping occurs. These contractions are normal and protective. For many women, this brings fatigue, mild bloating, or emotional sensitivity. Your body is asking for rest and nourishment. Listen to it. This is not weakness, it is biology at work. But while this shedding is happening, something remarkable is already beginning in the background. Phase 2, the follicular phase, overlapping days 1 to 13. Even as your period continues, your brain releases follicle-stimulating hormone, or FSH. Inside your ovaries, several small follicles begin to mature. Usually one becomes dominant. This dominant follicle produces increasing amounts of estrogen. Estrogen is your body's natural revitalizer. It rebuilds the uterine lining, making it thick and vascular again, preparing a potential home for new life. It also improves mood, energy, skin clarity, and even bone density. Many women notice they feel their clearest and most vibrant in the days right after their period ends. This phase is your body's renewal stage, and understanding it can help you plan your schedule, your exercise, and your self-care with greater wisdom. Phase 3, ovulation, approximately day 14 in a 28-day cycle, but highly individual. This is the pivotal moment. When estrogen reaches its peak, it triggers a surge of luteinizing hormone, or LH. The dominant follicle swells, ruptures, and releases a mature egg into the fallopian tube. That egg is viable for only 12 to 24 hours. Yet because sperm can survive inside the female reproductive tract for up to 5 days, your actual fertile window is larger than most people realize. Some women experience a brief, one-sided pelvic sensation called Mittelschmerz. You may also notice an increase in clear, stretchy cervical mucus, nature's perfect transport medium for sperm. Libido often naturally rises here. Your body is designed this way for a reason. Once the egg is released, the empty follicle transforms into a structure called the corpus luteum, a temporary endocrine gland that begins producing progesterone. Phase 4, the luteal phase, days 15 to 28. Progesterone now becomes the dominant hormone. It stabilizes the uterine lining, slightly raises your basal body temperature, and prepares the body for possible implantation. This is also the phase when many women experience premenstrual symptoms: breast tenderness, food cravings, mood fluctuations, or fatigue. These are not all in your head. They are real physiological responses to the natural decline in hormones if pregnancy does not occur. If no implantation happens, the corpus luteum gradually dissolves, hormone levels fall, and the entire cycle begins anew. This monthly rhythm continues from puberty until menopause, a testament to the incredible design of the female body. Emotional layer and real patient stories. I have sat with countless women in my practice who felt confused or ashamed by their cycles until they understood the science. One mother, 44 years old, told me her 13-year-old daughter had started her first period and was terrified because no one had ever explained it. After our conversation, she sat down with her daughter, used the exact knowledge I am sharing with you today, and watched her child's fear turn into quiet confidence. Another patient in her 50s realized her heavy, painful periods were not something she simply had to endure. Understanding the cycle helped her seek timely care and regain control of her health. These stories are why I make these videos. Knowledge removes fear. Knowledge empowers families. Common misunderstandings. What every woman should know. Many women still believe myths that are simply not accurate. You can become pregnant during your period if your cycle is short or ovulation occurs early. Cycle length varies naturally between 21 and 35 days. Perfect regularity is not required for health. Ovulation does not always happen on day 14. Stress, travel, weight changes, or age can shift it. Premenstrual symptoms are biologically driven, not imaginary. Tracking your cycle, even simply noting the first day of bleeding each month, gives you powerful insight into your overall health. Important medical guidance. When to consult your doctor. Let me be very clear. My purpose here is education, not diagnosis or treatment. I want you to understand your body so you can recognize when something may need professional attention. Please see your doctor promptly if you experience any of the following. Periods lasting longer than 7 days. Soaking through a pad or tampon every 1 to 2 hours. Severe pain that interferes with daily life. Bleeding between periods or after intercourse. Consistently irregular cycles under 21 or over 35 days. The sudden absence of periods when not pregnant or menopausal, or unusually large clots. These can be signs of conditions such as fibroids, endometriosis, polycystic ovary syndrome, or thyroid imbalance. Early evaluation often leads to simpler solutions. Always discuss your symptoms openly with a qualified physician. You have now journeyed with me through the complete monthly cycle, the beautiful, intricate process that defines female reproductive health. You understand the hormones, the organs, the purpose, and the signals. You are now equipped to explain this to your daughters with calm authority the moment they notice their first changes. But there is still one more essential piece I want to leave you with before we close. Thank you for staying with me until the very end. Your dedication to learning about your body matters. If this video has helped you even a little, please show your support by liking it and subscribing to Secret Anatomy. I strongly encourage you to become part of this community because the knowledge we share in every video is carefully researched and deeply important for your long-term well-being. Watch my other episodes on hormone health, breast awareness, perimenopause, and beyond. They are all here waiting for you. Comment below and let me know, what part of the cycle surprised you most? Or what will you share first with your daughter or granddaughter? I read every comment with care. Thank you for watching. Secret Anatomy is committed to your health and well-being. Stay informed, stay empowered, and I look forward to seeing you in the next video. Take care.